128,000 faculty members, 75,000 medical students, 110,000 resident physicians. So as you can see, Dr. Kirch is essentially the czar of academic medicine in North America. As you heard, he's certainly been a distinguished physician, scientist, and public servant. Dr. Kirch you heard, is a psychiatrist, a clinical neuroscientist by training, and began his career at the NIH, becoming head of the acting director of the National Institute for Mental Health. He's a native of Denver, Colorado, received his baccalaureate and medical degrees from the University of Colorado. Ladies and gentlemen, it is my great pleasure to introduce to you our keynote speaker, my good friend and colleague, Dr. Darrell Kirch.
I want to thank Dr. Reese for a very kind introduction and for the recognition of the medal. He is, many of you wouldn't know, but for many of us in America, he's considered the dean of deans in medical schools, and you're very fortunate to have him here at the university. I'm fortunate to be here. I'm humbled to be here today. It's hard for me to believe that so many of you took off this beautiful Friday and came all this way just to hear me speak. Actually, I know exactly why I'm here and what I'm standing in the way of. And I will be sensitive to that. But I have to say, when you get in a position to be a speaker at an event like this, the thing that amazes me most is the memories that come back to me. So next Friday, I'll be back in Denver with my class celebrating our 35th medical school reunion. But even though it was that long ago, there are memories that I have from medical school that are just indelibly burned into my brain. They're as bright today as the day they happened. And I think what you will find, believe it or not, is that you have some of those memories too. That the passage of time just isn't going to dim. So when I started medical school, one of my vivid memories was my first white coat. Now, we didn't have a white coat ceremony. You had one. I think it was in November of your first year back on the campus. But I bet you had the same experience I did when you put that coat on. It just didn't seem to fit. No matter how hard you wiggled or tugged at the sleeves, it just didn't feel right. In fact, I felt like a bit of an imposter. And what I finally realized was it wasn't putting the coat on. You know, I could load the pockets, I could practice the drape of the stethoscope, but I needed experiences to make it real. And it was those experiences that form those memories. Now, yours may be different than mine. For me, one of them is the first day of anatomy, walking in that room, the smell of formalin hitting you, but more than that, just wondering if I was really smart enough, tough enough to be there. Now, I was fortunate to have a Dr. Whitlock, who actually still teaches anatomy at Colorado. You were blessed to have Dr. Anderson, who I understand unfortunately died not too long after you were his group of students. But you know what I bet Dr. Anderson helped you understand is that beyond the tedium of anatomy study, there was a person who gave you the gift of their body in death so that you could understand about life. How many people receive a gift like that? I remember the first time they actually let me go in the room alone to see a patient. It was the VA. The patient was a World War II veteran. He was part of that greatest generation, but that war and what followed it had really taken a toll on him. And so I stood up straight, walked in, and introduced myself as the medical student who was going to help take care of him, and immediately this look of concern swept across his face. And while part of it probably was my inexperience, that word student, I think a big part of it was that he really wondered, was anyone going to take any time to get to know him, to not just dismiss him as another VA patient coming through. He taught me a lot, including at the end when he died in the hospital. A special memory for me, even though I didn't pursue obstetrics, was the first time I was allowed to, the phrase that's used, catch the baby. This was at Denver General Hospital, and I had watched, I'd read, I paid attention, and then one day the attending looked at me and said, "It's your turn." And I was very confident, and I walked up there, and indeed, I delivered that baby. And at that moment, the attending leaned close, and I thought he was going to say something like, "Now you are truly a physician." And he whispered, "I really wish you wouldn't hold the baby quite so tightly." And I actually loosened my grip and didn't lose the baby. But more importantly, I realized I just received another one of these gifts. Like, this couple had allowed me to participate in what was possibly the most intimate moment and special moment of their lives. You know, those are the kinds of memories. I'm sure you now have some moving through your mind, and they will stay there for a long time. Many of them won't involve the classroom or the patients. Many of them will involve your friends here, the bonds you formed. I can't wait for next Friday evening to see my former classmates. And many of the memories involve all of these people sitting out here. You know, somewhere out there, there's someone who maybe put you on the bus that first day of kindergarten. Maybe there's the person who bought you that first Fisher-Price doctor's kit and set the wheels in motion. I know there are people out there who wrote the check. But they're all here today. Tory, Whig, you know, it doesn't matter what your politics are, because now you're physicians. And as part of the profession, you cannot ignore the facts about healthcare in America. Now, I'm the first to say that in many ways we have the best medicine in the world. It is true. People will come from all over the world to get their treatment, their diagnosis, their procedure here. And we can be proud of that. We should very justifiably be proud of that. But there are other facts that now, as professionals, we also can't ignore. You know, the fact is, people who have health insurance live a longer, healthier life. Science has shown us that, and yet there are 50 million people in this country. There are people sitting in this room who don't have health insurance, and there are many others who fear losing it. We've left those people out in the cold. So even though this is a country that was founded on this principle of equality in healthcare, we've created a system where we have haves and we have have-nots. You know, but it isn't just a matter of making sure that people have health insurance that will fix our system. There are people here who are very well insured, but who don't have what you've come to understand is a medical home. Sure, they have a policy, a health policy, but they're medically homeless. There's no single physician who really understands their care and has built a team that will help them deliver that care continuously to you through your life as a patient. They feel bounced from specialist to specialist, and often those specialists don't even communicate with one another. You know, to give our patients those homes is going to take a lot of work. We're going to have to form true teams with our nursing, pharmacy, and other colleagues. And we're going to have to realize that our clinics, our hospitals, shouldn't be focused on us as the experts. They should be focused on the patients. And while we're at it, we need to figure out how we can more wisely spend that precious nearly $3 trillion a year we're currently spending on healthcare in this country. If we don't, we may have the right prescriptions for our patients, but the cost of healthcare will continue to bankrupt families and drag down our nation. So from now until November, sadly, we're going to be bombarded by politicians, and much of what they focus on will be blaming each other for the healthcare situation. But I guess I'd like you to think today about the fact that this isn't a political problem. At bottom, for us, given the degree you receive today, the oath you take today, for us, this is an ethical problem. When I was a first-year student, the course I liked best was ethics. Now, I admit part of it was simpler than most of the other courses I was taking, and the beautiful simplicity of medical ethics is there are only 4 principles. And you know what they are. Beneficence, it means do good. You will get up every morning intending to do good for your patients. The second one we call non-maleficence, but it translates as do no harm. Sadly, you know, the more we've learned, the more inadvertent opportunities we have to do harm. Too often we see that play out, especially at the end of life, where we get focused on prolonging life at the expense of also increasing suffering. The third principle is autonomy, not our autonomy as doctors, but our patients' autonomy. They're the ones who make the decisions. And the fourth principle, I would argue, is the one we struggle with the most. It's social justice. It's our obligation to make sure that all patients are treated fairly, that we use these precious resources wisely. But when and I know when you look at the healthcare system we have in the United States today, we see it filled with all sorts of forms of injustice. So we have these haves and have-nots. The haves sometimes get even more care than they need, whereas the have-nots don't get any care until they roll through that emergency room door on a gurney. You don't need to be formally trained in ethics to see the injustice in all of this. So I think when it comes to our ethical commitment, we have our work cut out for us. And I'm not saying that the physicians here on the faculty, that as you become physicians, you don't care deeply about patients. The doctors I know are the most caring and principled people I've ever been honored to work with. But I think what we've done collectively is we've convinced ourselves that these problems of our system are just somebody else's problem. But we've seemed to have forgotten that even if we didn't create this situation, we do have this ethical obligation to try and make it better. Now, I have to confess, I'm an aging baby boomer. I was a product of the 60s and 70s, and we were convinced we were going to fix everything in the world. But when I think of the members of my medical school class and I, this is one thing we didn't fix. So this is where I think you come in. And this is really the main reason I'm here today. You know, maybe you will be the ones to help my generation recapture that ideal and actually realize it. You're going to be tested, there's no doubt about it. Your student loans need to be repaid. You're going to receive pressures from every side, bureaucratic pressures and others when you're in practice, the administrative burdens, will weigh you down, and it will be very tempting to just fall back and protect your self-interest. That's when you and I will need to remember that ethical commitment. I think you're the right people. I've learned a lot about your class. You know, you wouldn't have done the Sight Savers project where you did glaucoma screening. You wouldn't have worked in the Health for the Homeless program. You wouldn't have done Project Feast, working so hard to make certain people have Thanksgiving dinners. You wouldn't have done those things if you didn't want to make a better healthcare system. So by reaching out, you've already shown that you understand the ethical commitment that we share. So I urge you to bask in the glory of this special day. I know none of you will remember I spoke to you today, but I do know you will hold that set of memories just like I do that you're going to cherish, not just for your career, but for your lifetime. And I especially hope you find the courage that we all need as physicians to finally make good on our ethical obligation. We can finally create a healthcare system that works for all of us. So let's make each other a promise today. Let's never lose the sense of doing good, creating a better, healthier society. Remember when you wrote that personal statement on your AMCAS? Pull it out, because that's what you promised to do then, and that's what I want you to promise to do today. Thank you.
Thank you, Dr. Kirch. On behalf of the School of Medicine academic community as a whole, I want to extend our sincere thanks and appreciation for not only participating in our exercises today, but for the sage advice, and I think equally important for the challenge that you've given our graduating class. I know our students, I know they'll take it very seriously, so thank you so much once again.